Jessey Nuwagaba, a former pupil at Angodigodi Primary School in Katakwi district, is at a crossroad in his academic journey. Despite achieving an impressive 11 aggregates in the 2024 primary leaving examination, making him one of the top performers at the remote UPE school, Nuwagaba is uncertain about how to proceed. His hopes for further education are shattered by the ongoing health struggles of his mother, who is battling cancer and can no longer provide for him.
I don't have school fees for going back to S1 because I'm taking care of my mother. I don't have time to even go and work for money. I'm not able to do it alone, so I don't know if I would go back to school.
At the primary level, Nuwagaba worked odd jobs to support both his education and his sick mother. However, the challenges have become overwhelming and he can no longer manage.
When I was in primary, I used to fetch water for some bricks, some people's bricks, and I get some money for buying books and school requirements. When I'm taking care of her, sometimes we stay hunger when we're at the place of treatment where we go. Sometimes even transport to go there, it's a challenge.
Raising money for food, transport, to take his mother to Mulago, and paying for school fees has become a nightmare for Nuwagaba. His greatest wish is to finish his education and return home to care for his mother. Nuwagaba's mother, who was the sole provider for the family after the death of her husband 10 years ago, has been fighting breast cancer since 2018.
I went for surgery. After surgery, I was put on chemotherapy and then radiotherapy. Then now, I've been put on tamoxifen for 10 years. So I keep going to Move Cancer Institute after 3 months. At the moment, I was supposed to report last week, but again, still I don't have money. So, I also have a problem with my throat. I've developed a goiter, and they are telling me surgery, whereby there is no money.
The costly treatments have depleted the family's meager savings, further complicating their already difficult situation.
Even the work I used to do hairdressing. But at the moment, I cannot do the work because my arm is swollen. The arm becomes swollen. It's now 6 months. I'm with the child, but I don't know how the kid will go to school.
Susan Akiteng, Nuwagaba's mother, says that her son's academic performance could have been even better if not for the constant interruptions in his schooling.
The child is at school. I'm alone. When the child is in holidays, he moves with me. I just say, let me move with him. He takes watch over me. I might fall.
She had to take him with her to Mulago Hospital for treatments, but doctors eventually advised her to stop bringing him as the traumatic scenes at the Mulago Cancer Institute were affecting him deeply.
So nowadays I go alone. You first have to look for money, then go. Sometimes you go with even less money. You reach there, they tell you to do checkups. There is no money. Sometimes you come back when you have not done checkups.
Speaking to NTV at Owen Medical Clinic in Sorority City, where she and her son had gone for malaria treatment, Susan reflected on the mixed emotions she feels about her son's situation. While it saddens her that she can no longer afford his school fees, she also feels a sense of relief that her son will be spared from the burden of trying to continue his education under such difficult